right, so on this particular person, we have had some recent headaches, and so if we go check the most common parts of the neck that cause these, there's some right there.
Yeah.
You can kind of see her face, and so
Yeah.
when I press that, where do you feel it at?
Going up this way.
Yep, so that's how we know that this is involved in the headache. So we got to treat this one right here. And so one of the ways that we can do that is we can rock her away, hold some gentle pressure right underneath the skull right here. And what I'm gonna do is just slowly just bend her away. And I'm just pulling on that muscle, yep. And I'm just doing a gentle dynamic stretch right here on these muscles. Good. Yeah. Just like that. Okay, so. How's that feel after doing that?
Better.
Like less radiation?
Yes.
It's probably still going to be tender, but if we knock the radiation down, that's what matters because that's actually shown us it's reducing the headache. Now I'm going to check the second most common spot. And most people have 2 of these. So usually it's about here. Do you feel it? Yeah, right there.
Oh, yeah.
You can see your face. So on this one, what we're going to do is something very similar. We're just going to pin this muscle right here, right on top of the trigger point. And I'm just going to rotate her head away like that. And then we're going to come back. I'm going to apply some pressure and we're going to rotate again. Yep, just breathe. Good. So just applying gentle pressure, hitting that tight muscle, and then elongating it so we actually get that knot or trigger point to break up. Good job. So it does work better with these dynamic movements compared to static movements. And there are a lot of ways to do this. We don't always do it this way. It just kind of depends on the patient. We can do this with instruments. We can do this by hand, and we can do some of these with shockwave therapy if it's really bad and we know we're not going to be able to get it out as effectively by hand. Good. And then we can follow all this up with just a gentle stretch that gets everything. So what we'll do is just rotate her away, kind of grab the base of that skull, and then I'm just gonna pull a little bit. Then I'm gonna have her press into me, back into the right, and then let that, good job, let that go. All right, press again. 1, 2, 3, let it go. Good, and press again. Let it go. Good. And so now we're just gonna go recheck all that. You feel a difference there? Less radiation, still tender?
Yeah.
Yep. Yep. So that's how we treat the soft tissues that are responsible for headaches.